Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. Thank you for joining us today for our virtual office hours about reimbursement. And we are recording today's session and we will post it on our website under archived events. There are no PowerPoint presentations today. This is really more of a chance to have an interactive discussion regarding reimbursement for telemedicine. I'm going to introduce my coworker here, Cameron, or Cam as he likes to go by, and he is going to take us through some questions. He sent out a survey for those of you that registered. You might have gotten a chance to ask just a couple of questions that gave us a chance to do a little bit of research about your questions before today's virtual office hours session. Also, we are in a meeting mode today, so you can unmute yourselves to ask questions when we get to that portion of today's event. You can also ask questions via the chat, and I think that's it. Go ahead, Cam. What kind of questions did we get from our survey?
Sure. So one of the questions that we received is, can a FQHC bill code G0506?
Absolutely. And I'm going to share my screen. So billing for telemedicine and virtual care is sometimes a difficult thing to keep track of. So can you, I think I did the wrong thing. You guys see a big tree, don't you? Yeah, I want to share this screen. There you go. Now, can you see our website? Is this what you're seeing?
Yes.
Okay.
Yes.
So there are a lot of different resources on our website and a bunch of other pages that I'll share as we go through our discussion today, and then I'll make sure that our facilitators, Carolyn and Autumn, get that information, and we'll email these links out to you that we discussed today. So for the question about billing 0506 for FQHC, this resource here from CMS is their MLN booklet, or their Medicare Learning Network booklet. This is the official guide for what you can and can't bill via telemedicine or telehealth services, is how they talk about it. And this tells you all kinds of things about who can bill for telemedicine. This year with COVID-19, a lot of things have changed rapidly. So there are different fact sheets that CMS has put out during the public health emergency, and I'll clue you into some places where you can look and see not only what were the codes that were billable prior to COVID, but also what are the codes that were added. There were like 80 different codes added and services expanded during the public health emergency. Now, this public health emergency is still going on. We don't know for sure when it's going to end. Right now, the federal public health emergency is set to end at the end of October. We do expect it to be extended at least another 90 days. And then after that, we'll just have to see where we're at. So to go ahead and answer the question that was, the specific question that was asked was about G0506. And if you scroll through these lists of services and HCPCS and CPT codes, we will indeed come down here and find G0506 right here. And that is comprehensive assessment and care planning for patients requiring chronic care management. So the answer to that question is yes, it is billable under Medicare. What's next, Cam?
So to kind of piggyback off of that question, there was a question if instead of billing G0506, if you can bill for AWV to create a care plan.
So for chronic care management, they're really specific about that. The annual wellness visit, which is up here, G0439, would be billed separately. Now, FQHCs and RHCs have rules that are just a little bit different sometimes from other hospitals and other inpatient centers. So you could do both in the same day, but it would have to be 2 separate appointments. You'd have to have one appointment for the annual wellness visit and then a separate appointment for the care planning for chronic management. Next.
Can you bill add-on codes?
I would need more information to be sure to answer that appropriately. So I would encourage that individual, if they're on, to go ahead and type something in the chat to give us some more detail. Or if you're listening and you want to unmute yourself, you can certainly do that as well and clarify your question. All right, do we want to go ahead and go on to the next question?
Sure. There was a question about how will the new telehealth codes impact 2021 and reimbursement?
That is a great question. So the Center for Connected, well, actually, let me do this. Because we didn't do a poll about if you guys have ever worked with us before or if you're new to telehealth resource centers. This is the national map of all of the telehealth resource centers around the country. You'll see behind me, I've got my logo for the 4 states that we cover, which were the lilac states here: Illinois, Indiana, Michigan, and Ohio. But there are 12 regional telehealth resource centers around the country, and then also 2 national resource centers. We have one for policy, which I'm going to use a lot today and reference their website, and then one for technology. And so that's the other logo, the National Consortium of Telehealth Resource Centers. All 14 of us work very collaboratively together to make sure that we're answering questions in the same manner across the nation and everyone's getting consistent information. So the National Policy Center is the Center for Connected Health Policy. And they did a fact sheet in August, right after the proposed rules for Medicare for 2021 came out. So this happens on an annual basis. Every year, CMS gets requests to add new codes to that list of that Medicare Learning Network fact sheet that we were just looking at with the G0506. And so usually into July, they come out with the proposed rules for the following year. And again, we're speaking specifically to Medicare reimbursement here. I personally don't like the way the columns in the Federal Register for me are very difficult to understand and read. So I use the Center for Connected Health Policies fact sheet that they come out with, and other organizations as well. Instead of reading the code verbatim, I find it easier for me to digest and be able to speak about. So there are several things that I wanted to say about the fee schedule. It does talk about and this is 6 pages. It does talk about the new codes that were added during COVID, and that was in March, part of the CARES Act. And some of the waivers and extensions. As I mentioned, there were 80 new codes that were added during COVID for telehealth reimbursement. So there are some codes that they are proposing, and again, this is still a proposal. We won't know probably until December what codes are going to be carried forward into 2021. The comment period is still open. However, if you see something that you really want, your organization or you as an individual wants to comment on, the comment period for the proposed fee schedule for 2021 closes on October 5th by 5 p.m. Eastern. And the link is in the handout here where you can go and submit comments if you'd like to do that. So this first group of codes are codes that they're proposing to add and taking comment on. So some good things here. We see prolonged services, complexity, visit complexity, group psychotherapy, caring for patients with cognitive impairment. Here we see domiciliary, rest home or custodial care services, and home visits. So great areas to expand reimbursement for telehealth there. These, so then it talks here in this paragraph about, these are category 1 up here, that they always add new codes every year. So then there's category 2, which are some of the codes that were added during the public health emergency that may or may not make it into the permanent list of codes. And then there's category 3. These are some additional proposed codes that CMS is soliciting comment on. So these would remain on the Medicare eligible telehealth services list through the calendar year in which the PHE ends. So if public health emergency gets renewed into the end of January, or actually October, would probably be ended in December or January, depending on how many days they extend it for. Let's say it goes, the next one goes until January, and then in January 2021, the public health emergency ends, then these codes would still be billable through the end of 2021. So these are some codes that were added as part of the public health emergency, but they're not quite sure yet if they want to keep them long-term. And then they talk about the communication services. So one of the sets of codes was for audio only. That became a big issue, especially for seniors and those in rural areas where they didn't have adequate broadband access to do an audio visual call. So there were some codes added in the series 99441 through 99443 just for audio only. And the reimbursement for these is very minimal. It's, I don't know, $15 to $20. So there is a lot of talk about whether or not those are going to go forward. So it'll be interesting to see what comes out in the comments for that. Overall, then there's a lot talk about remote psychological monitoring services. Supervision has been a big issue. So it looks like they are going to allow direct supervision via real-time interactive audio and video, which is generally what they ask for a telehealth reimbursement. And then teaching physicians, this has been an issue. With rounding and internships, how to do that and still remain socially distant. And then there's a bunch of other proposals here as well. And then some clarification for existing policies. Here's the information on how you can submit comments. So back to the question. All that is background information. So can you read the question again?
Give me 1 second, Becky. But
sure.
Yes.
Sorry.
So the question was, how will the new telehealth codes impact 2021 in reimbursement?
So I think that they will impact them positively. We're going to get some new codes. Hopefully we'll see extension of some of the newer codes that were added during COVID. There is the new technology-based services that they're talking about include clinical social workers, clinical psychologists, physical therapists, occupational therapists, and speech language pathologists, which is great. The PT, OT, and speech language pathology, none of those providers could offer services via telehealth prior to COVID. So that's been an expansion, which was very positive for those in that particular area as far as healthcare providers go. In general, I think telehealth is here to stay. Seema Verma said in one interview, and Seema Verma being the head of CMS, that you can't put the genie back in the bottle. Telehealth has been around for a long time, but COVID has really brought it to the forefront. to be able to take care of patients and still maintain social distancing. We can't do everything via telehealth, but I think there's a lot of services that do lend themselves to being delivered virtually. And some of the changes we're seeing in state Medicaid programs about allowing the patient to be at home during the service. We're seeing that those are being extended and part of the normal Medicaid fee-for-service offerings as well. Already in Michigan, that has been made permanent. Ohio Medicaid started to allow patients to be seen at home for telehealth services last July. Indiana, there's been talks and we're looking at it. Off the top of my head, I can't remember where Illinois is at. So if anyone on the call remembers that, certainly please let us know in the chat. Any other questions regarding the 2021 fee schedule? Cam, where do we want to go next with our questions?
So we also received a question about what CPT code should a primary care physician use for COVID-19 encounters during a virtual consultation?
Okay, so I'm going to ask a question back and say, well, what code would you use if you were going to see that patient in person? Normally, when you offer services via telehealth, you're billing the exact same CPT code as you would as if you were offering those services in person. And I will point you back to the Medicare Learning Network fact sheet about billing and payment. And down here at the end, it's got all kinds of resources, but it talks about billing here. And this was the pre-COVID, using the GQ modifier. And then in our policy, our National Policy Center, this particular page that we're going to send out is how they have documented things. And they have taken a crosswalk between what it was pre-COVID and what it is currently during COVID. This is an FQHC document that I've pulled up here for RHCs and FQHCs, but the other document that I will send out talks about what modifiers to use and whether to, in the place of service field, Medicare is asking that you use the place of service where it would have happened if it weren't for COVID. So if you are seeing a patient for behavioral health services and they would have come into a clinic location, but now they're being seen from home because of COVID, then you're going to put in that clinic location so that you would get reimbursed appropriately for that clinic fee. Next.
So another is, how do you code differently for a telephonic visit versus audio-visual?
Mm-hmm. So the telephonic visits, those are the codes 99441 through 99443 that you would bill for audio only. And again, those are going to have a lower reimbursement than an audio-visual visit. Now, some folks have asked us, what if we start trying to use an audio-visual and then there's internet issues or technology issues? Do we bill audio only, or can we still bill the higher with the normal CPT code? The answer is, if you have met the criteria for the clinical exam that you're trying to do, then you can go ahead and bill the higher reimbursed CPT code. If at the very beginning you run into issues and you haven't met that normal clinical criteria for that particular visit, then you have to bill using the audio only codes. Next.
And then another question we received in the chat is, can you comment on some of the main things to consider for FQHC billing telehealth under COVID-19?
The biggest barrier that was removed for FQHCs and RHCs under COVID was the Medicare waiver allowing the patient to be at home. Medicare prior to COVID, only allowed the FQHC or RHC to be what we call the originating site. Sometimes it's called the originating site or the distant site or the spoke site or the patient site. They never allowed, prior to COVID, the FQHC or RHC to be the hub site or the provider site. So the hub site, the provider site, the distant site, but where the provider is at. So this has given FQHCs and RHCs a lot of latitude to be able to perform services via telehealth, where previously for Medicare patients they couldn't. All 4 states that we have in our region, Illinois, Indiana, Michigan, and Ohio, do allow for FQHCs and RHCs to be both the originating and the distant sites. They can be both the patient site and the provider site. And right now, with the public health emergency, it doesn't really matter where the patient's at, and it doesn't really matter where the provider's at. Now, the provider needs to be licensed in the state where the patient's at, physically located during the visit, but they could both be at home, and it would still count as long as the clinical protocols for the visit were met. Next.
We received some similar questions, and I know you addressed this a little bit, but maybe we could go into more detail. But we do have some questions about basically the future of telehealth following the COVID-19 pandemic.
Sure. I don't have a crystal ball. I wish I did. I could make a lot of money. I'll kind of go back to my comments about Seema Verma saying we can't put the genie back in the bottle. I think we've seen that the efficacy is there, that the patients love it, the providers love it. It's a more convenient way of providing care, and I think it's here to stay. The future of healthcare in our nation is a hot topic with the upcoming election, but I do think it's going to change. It's going to morph. Technology has made things so much easier in many ways. I think the consumers are going to demand it. I've got young children, and they don't know a world without the internet or without cell phones or without tablets. If I handed them an old landline phone that had a rotary dial, I'm not sure that they would know what to do with it. So technology is changing our lives and the way we consume healthcare. I fully expect it to continue.
And that looks to be all of the questions that we received from our pre-survey and that are in the chat. So now we can open it up and see if anyone has any additional questions that you would either like to put in the chat, or feel free to unmute yourself and ask any of those questions yourself as well.
I think we got time for 1 or 2 questions.
Oh,
I have a question.
Oh, go ahead.
Hi, yeah, I'm in Chicago with FQHCs. Just wondering, we hear under this emergency period all these very helpful real life scenarios where we can bill under these new telehealth mandates. But are we seeing any getting information about reimbursement? Is there any mandatory timeframes? Is it still 180 days? For clean claims, if you need to reprocess, anything about that you could share in terms of actual getting payment?
I haven't heard that I have not heard any changes to that 180-day rule. But if you want to, my email is in the chat. If you want to send me an individual email, I can try and do some research on that and follow up with you.
Great. Yeah, I'd just be curious. Are people getting paid?
Oh,
Yeah.
as far as I know, they are. I don't know. Everybody else on the call, are you guys getting paid?
At what you thought you were billing for, right? And getting that amount.
Mhm. I've heard, every once in a while we'll get a call from somebody that says they aren't getting paid, and we look at the claim, and it usually is an issue with the telehealth modifier or something else clerical in the bill, and we're usually able to help them get it paid. There's something in the chat. Kelsey, I've seen some stuff about Medicare Advantage plans and FQHCs, but I can't recall where off the top of my head. If you would send that to me in an email, I would appreciate it, and I'll follow up with you. And then somebody from AAFP has got something. What's this? Oh, yes. Let me read this. James Dara. E-visit codes, EM codes. I would want to double check. I don't remember all the codes off the top of my head. I remember these, but I think this is probably still pretty accurate. AAFP is a good source. On our website, we've got some patient, if we go over here to resources, we've got some good provider and patient resources here. There's which one, this was the telehealth workflow was the one I was thinking about. But we didn't put codes in this one. All right, Kim, do you want to tell them about the post survey?
Sure. So basically, with the amount of interest that we have in these billing and reimbursement questions, one thing that we're trying to really evaluate is if there's a need or a desire for us to have open forums like this where we're addressing billing and reimbursement questions on a more frequent basis. As well as we know that there's probably several other questions that we didn't have time to get to or to answer today. So what we're really hoping to do is be able to collect some of those. Now, these surveys are anonymous. So if you are hoping for us to individually follow up with you, please make sure that you write down an email address or some sort of contact information for us to get back to you in that text response within the survey. Otherwise, we won't know who we need to follow up with for that. But we would love your input to see if this would be something that would be beneficial either on a monthly basis, every couple months. So any input you can provide for us would be a great benefit for us. So thank you.
Yeah, and Caroline put the red cap link. I will copy this and paste it so it's at the end for the post survey. I also put in the link where you can sign up for our mailing list. If you wanted to do that, we send out information on our mailing list, usually at the beginning of each month with events for the upcoming month. We do have our website at umtrc.org, and we also have a Facebook page and a LinkedIn page where you can follow us there as well. All right, any last minute burning questions? All right, well, thank you all for joining us today. Have a great rest of your day. Thanks, Cam and Caroline.